So let's discuss the functions of 12 cranial nerves. This is made easy and simple. Well, this diagrammatic sketch makes it very easy to identify the functions of cranial nerves because it helps to allocate anatomically where the cranial nerve serves or where they functions. Well, it starts with drawing a 5. This 5 is not just a number. This 5 is not just a number, but it represents cranial nerve number 5, which is the trigeminal nerve. And then we will draw 7 on both sides. We want it to appear like a fascia, and this 7 is not just a number as well, but it represents the faciocranial nerve. It is drawn on both sides, but it signifies faciocranial nerve number 7. And then after this, we're going to draw number 11 somewhere here, and it will appear on both sides, and it will appear on both sides like this. So it's like a face extending to shoulders. So number 11, as you all know, is the so-called accessory cranial nerve. And after this, we are going to draw number 8, which is the vestibulocochlear on both sides, as you can see. And as you know, vestibulocochlear represent the cranial nerve number 8, which always help in balancing and hearing, usually the function of the ears. And now we draw the cranial nerve number 1 somewhere here, which represent the olfactory nerves, usually the nose, and the optic nerve number 2, which is usually the optic nerve representing the eyes. And we have the number 3 responsible for eye movement. And also now we just write now 4, which is usually the trochlear cranial nerve. And then just here we have number 6, which is the so-called abducens. And now we already have number 7, 8, and 11. Then let's find number 10, 9, and 12, which are usually just in the mouth. And this is presented diagrammatically as follows. This is our tongue, and we assume number 12 is here. We assume number 12 is here, and number 9 is here, and number 10 is here. Where number 12 is the hypoglossal, number 9 we all know is the glossopharyngeal, and number 10 is the vagus nerve, responsible for swallowing and other involuntary activities. So now we have all the cranial nerves in their anatomical positions. That is where they serve their functions effectively. Let's look at the functions of each one, now that we have known the anatomical location of each cranial nerve from number 1 to number 12. In summary, the olfactory is now sensory nerve, which help in sense of smell, and you can see anatomically just at the nose from the diagram. And we have the optic nerve, that is nerve number 2, which is sensory also and responsible for vision or seeing. That's why from the picture it's located within the eyes. The diagram shows that. The oculomotor is nerve number 3, and it's purely motor, and it is responsible for eye movement. That's why it's in the eyebrow from the diagram, and it helps in opening of the eyelid and pupil constriction, and sometimes lens accommodation. You know the eyebrow, when you try to move it here, that's what it is. So the trochlear is also for the movement of cholera, and it's motor, that's eye movement. The trigeminal nerve, which is both sensory and motor, has 2 functions, that is opening of the jaws and closing of the jaws, simply chewing of food. That's where we get the trigeminal nerve. And as sensory function, it helps in facial sensation, like when you feel like something is touching your face, or pain, and also sensation of the tongue. Abducens is nerve number 6, and it is a motor, and here it's also helping eye movement. So we have number 3, number 4, number 6. These all are collectively for eye movement. You know that, where number 3 is the oculomotor, number 4 is the trochlear, and number 6 is the abducens. Number 7 is the facial nerve, which is both sensory and motor, and as motor functions as facial expression nerve. That is when you smile, when you have facial grimaces, frowning of your face, and also lacrimation, that is production of tears, and salivation, that is in the mouth. But as sensory, it is responsible for taste, especially in the 2/3 anterior of the tongue. So these are as a very vital role. Cranial nerve number 8 is the vestibulocochlear, simply sensory, purely sensory, and it is within the ears, that is hearing and balance of the body, simply its function. Number 9 is the glossopharyngeal nerve. This is also as motor and sensory function, and with the sensory it simply helps in swallowing, so it works together with the vagus nerve and other nerves to help in swallowing. But as sensory, it helps in sensation of the tongue posterior, 2/3 of the tongue. And then we have the cranial nerve number 10, which is the vagus nerve, the common nerve known to men. It has both sensory and motor function. So function as a motor, it helps in swallowing, talking, coughing, mostly all in the involuntary activities. But as sensory, it helps in taste near to epiglottis. Here, as the food moves near to epiglottis, it tastes so that the epiglottis can close as it senses that this is food, so it doesn't run into the trach. We have the accessory nerve as nerve number 11, which is purely motor, and this one simply helps in shoulder movements and head movements. That's the cranial nerve number 11 innervations function. So if your patient has no head movement, nodding or shoulder, it's the cranial nerve number 11, that's the accessory nerve affected. Number 12 is hypoglossal, which is purely motor, and it takes a vital role in tongue movements. You see that? So tongue, eye, and face, and swallowing is the major areas where the cranial nerves functions. Thank you for watching. Stay tuned for another video. Do not forget to subscribe.